Here at the Royal Belfast Hospital for Sick Children, we know that having a child in hospital is both physically and emotionally draining. The hospital environment can make it difficult to sleep well, eat well, or move your body regularly. Parents and caregivers tell us how they feel concerned about their child, helpless that they can't take the health problem away, and often torn between the child in hospital and life outside hospital, perhaps by other children at home, by work commitments, or by financial worries. Taking time to look after yourself in this situation is really important, but not always easy. We have created this video with you in mind. We encourage you to take the next few minutes to follow along. You can be reassured that taking the time to take care of yourself, you will be better able to tend to your child. The following movements are designed that you do not need any special equipment, you don't need a yoga mat, you don't need any special clothing, and they can be done in a small space, either seated in a chair or even on the side of a bed, and you do not need to be lying down. So I'm going to give you a couple of options for how you can place your arms and your hands. So the first option is just taking your left hand and placing it underneath your armpit with your thumb pointing up towards the ceiling. And then you can take the opposite hand onto your opposite arm. And here you can just give the arm a little squeeze. You can give underneath the armpit a little squeeze, let the elbows be soft. So this is your first option. The second option is to take your hands facing in towards your chest and just interlace your thumbs. And then we place the hands back down onto the chest, let the elbows soften down away from the body. And then the third option is take your hands into your lap here. Again, letting the arms be soft, let the shoulders soften. And then taking a few moments again just to feel the soles of your feet on the ground. Let your shoulders soften down away from your ears. You can let your gaze lower down towards the ground, just softening your eyes. And if it feels comfortable, you might even like to let the eyes close halfway or let the eyes close fully. And we will begin the practice. So bringing your head into an upright position and gently soften through all the muscles of your face. And when you feel ready, just bring your attention to where you can feel the sensation of your breath most in your body. You might notice you're breathing through your nostrils as you breathe in and you breathe out. You might notice you're breathing in your chest as it rises and falls. Or you might notice you're breathing in your belly, rising and expanding as you breathe in, and then softening back as you breathe out. So just take a moment and just notice where you feel the sensation of your breath most. And then just allowing your attention to rest there very gently. And now as you're gently holding your attention in the flow of your breath, see if you can find a soothing or calming breathing rhythm. Take a little time to experiment with this, to explore what your breathing rhythm would be like if it had a soothing or calming quality to it. It may be that this rhythm is a slower and deeper rhythm than usual, but one that feels comfortable to your body. If you notice your attention moving away from your breath, or that you become distracted in any way, just very gently bring your attention back to your breath and tune back into the calming or soothing quality of your breathing rhythm. As you continue, see if you can imagine a sense of slowing down in your body as you breathe out. It can also be helpful to notice your body feeling a little heavier as you breathe out, whilst your legs are supported by the chair and your feet grounded on the floor. Continue practicing this breathing rhythm for another few moments, mindfully noticing when your awareness is distracted from this focus, and gently bringing your attention back to rest in the flow of your soothing, breathing rhythm. And when you're ready, you can lower your chin down towards your chest, feeling a gentle stretch along the back of your neck. You can let your eyes open, and when you feel ready, bring yourself back into the room, bringing your practice to an end.